Okay. Hello, everyone. Good afternoon, wherever you are, and good morning, and welcome to our third session today on discussion of vaccine hesitancy. And this week, it seems particularly a very important point, as we've been hearing of several countries in the continent actually having to dispose of vaccines or unable to use the vaccines that they've had allocated or may have purchased, given the short time span of the vaccines. And so, from our perspective, we think or we believe that vaccine hesitancy is a key criteria, or addressing this is probably a key issue for successful vaccine programs, which has been seen sort of increasingly across the world. I saw preprints of vaccine rates across West Africa, and it's it's extremely low, and many countries have sub 1%. I think very few countries have reached the 20% level. And this week or earlier, between our two sessions, we were also reminded about the possibility of the new variant, which was genetically sequenced in South Africa. Africa had a first, although not so celebrated around the world for Africa, South Africa being the first to be able to sequence this variant, which may or may not have started in Southern Africa. But I think it's just a reminder about the importance of, until there's a high herd immunity around the world, we are all exposed wherever you are, to the COVID vaccine. And the conversations we've had with healthcare, focusing on healthcare workers, and the second one focusing on religious and community leaders, all talked about the important role of media influencers, both formal media and also informal media influencers. And so that's what we're going to be talking today. And we have a wonderful panel, and also moderated by a significant media influencer herself, both in person. And so we really are very delighted to have a wonderful panel, and we thank all of you for joining us this afternoon or morning, wherever, or evening, wherever you may be. So I'm going to hand over to our co-host, and you can see Anadak behind, so I'm talking on behalf of Anadak. And so I'm going to hand over to Repka, with our dear associates who are co-hosting the event with us. And Repka, over to you for a few words.
Good morning, good afternoon, good evening, Africa. Welcome to the third series of our webinar on vaccine hesitancy in Africa. My name is Rupkat Nafuboye. I am the founder and CEO of RDA Africa, co-hosting this webinar series with Dr. Egbe and Anadak Group. So hopefully you were with us on the first webinar when we focused on healthcare, the role of healthcare providers. The second webinar, we focused on community leaders as well as faith leaders. And today, welcome to you all as we discuss the role of the media and the hospitality industry. So we have a fabulous session planned for you, excellent panelists, and a fantastic moderator who's been my colleague for a while now, and I love getting to know her more and more. So we're going to have a dynamic conversation. This conversation about webinar hesitancy is so absolutely important, as Dr. Igby covered. And so it is, as we really work and advocate for increased access to vaccine in Africa, and dismayed by the low level of access to vaccine, we must at the same time also prepare our population to accept and receive vaccine 1 and vaccine 2, and now booster vaccines as well. So this conversation is absolutely paramount and must go parallel with our efforts to increase access to vaccine. So that said, I'm going to introduce my wonderful colleague and our moderator for today's conversation, today's webinar, Helen Mesfin, from our very popular Helen show that is very, very well received in Ethiopia and Ethiopians in diaspora. While I give an opportunity for Helen to introduce herself, I'm going to encourage all of you to complete a poll that will be appearing shortly. And those of you that are hosts and speakers today, please do not complete the poll because that will kick you off. So please, reminder, speakers and hosts do not complete the poll, but everyone else, please do. This is vital information for us to collect this survey. So also chat, the use of chat, please post your questions on the chat. We will be closely monitoring the chat and fielding questions to our fabulous moderator and the panelists, and some of the panels will actually respond to the questions on the chat itself. So we invite comments and we invite questions on the chat. So with that said, Helen Mesfin, I turn things to you. You are part of the media group that we're going to be discussing about, and I'm sure you've done tremendous amount of work around vaccine hesitancy on Helen. So welcome, Helen.
Thank you for having me. Thank you for extending this invitation to join you. Yes, my name is Helen Mesfin. I host a television program on EBS TV, which is Ethiopian Broadcasting Service. We have about 25 to 30 million viewers in Ethiopia and around the world. And I've been hosting this program for the last 10 years. And essentially, this is a platform where we discuss different issues, where we empower people with information. We talk about healthcare, we talk about parenting, we talk about marriage, typical talk show format where we address a lot of the issues that impact our community. And I have done a number of shows on COVID from the beginning until now. We've talked about, what COVID is. We've invited physicians, researchers, and many different topics related to COVID, including vaccine hesitancy, conspiracy theories around vaccine, misinformation, disinformation. All of you know that it's out there. And so we know that media plays a very, very critical role in informing people, in making sure that people are not subscribing. It's going to happen.
Hi, this is AJ. How are you? Okay.
The world that we live in, we still want to inform, we still want people to know what's out there, and we still want to encourage people to be vaccinated, because that is really the way for us to combat this disease. And we know, I live in the States. I personally have been vaccinated. My husband is vaccinated. My children, my 18 and 14-year-old are vaccinated. Everyone in my family that we can push is vaccinated. My mother, who is 75 years old, dementia patient, she is vaccinated. My father in Ethiopia and my brother is vaccinated. Whenever you're able to have access, we're definitely pushing that. So I'm really glad to be part of this conversation. Without further ado, I know our first panel session is going to begin now. I'll introduce our two speakers, and then we have another session following after this, and we'll introduce the other two speakers that we have. So for the first panel discussion, Ms. Jolene Samuels, welcome. She is the founder of Job Raffles Vaccine Initiatives in South Africa. Welcome, Jolene. Flavia Nasaka, reputable health and science journalist in Uganda. I know the conversation, Jolene, you've shared with us a little bit ago about Job Raffles. So I'm going to ask you to briefly tell our participants what that is. And then we're having the second panel discussion later with Mr. Michael Heine. And then he's a president of Global Training Center. We'll do his introduction a little bit more detail later. And then also Ms. Igo Boyo. She's an actor, producer, creative entrepreneur, and founder and managing director of Temple Productions. So welcome, everybody. Jolene, I guess Jolene and Flavia, let me start with you both by asking, are you both vaccinated? What's your vaccination status?
Good morning, good afternoon, good evening, everyone. Thank you for having me. It's such an honor and a privilege to be part of the show. Yes, I am fully vaccinated. I got my first vaccination shot on the 15th of July. I have to admit, though, I was hesitant at first. I have to be honest. I was hesitant at first, but that was due to misinformation and the general distrust when it comes to vaccine trials and people of color. And a friend of mine started posting simplified messages on social media, on Facebook, and he used that platform to inform people about the importance of vaccines and why it's important for us to get vaccinated. And then because of that sensible and simplified information that was shared with me, then I started realizing, okay, this is why this is so important, because someone simplified the message for me. And you know, there's so much misinformation out there that I didn't know what to believe, but someone actually simplified the message and made me understand, and made a lot of us in South Africa understand why it's so important for us to get vaccinated, and that encouraged me, and then I decided to get vaccinated.
That's wonderful. How about you?
Yes, sir. It's an afternoon in Uganda. Good morning, good evening from wherever you're calling in from. I'm a long-time journalist in Uganda. I started reporting early in 2014 when I had just graduated from university. I first worked for a print media organization called The Independent. Then I moved to Uganda Radio Network. Uganda Radio Network is a press agency that supplies news to subscribing media houses, including print and radio. And yes, Helen, I am vaccinated. I got vaccinated the same day when the first person in Uganda got the jab, and it was first the Minister of Health who got publicly immunized as a way to encourage others. Then journalists were given an opportunity, because at this time we were moving, we are considered frontline workers here, because we move everywhere to the hospitals with these policymakers, with the people really at the front line of COVID-19. Yes, I received AstraZeneca vaccine.
Oh, wonderful.
Over to you,
That's
Helen.
great. Okay, well, wonderful. Thank you. So let me ask Jolene, you just, recently, when I introduced you earlier, I said, job raffles, and you have, this really illustrates what, the power of influencers and what people like you, like the everyday people, the average people who, inform themselves and then decide to inform others, use various social media platforms to be able to spread the message. And so job raffles is just that. So tell us, just to illustrate to our, viewers and listeners what that is and how you're helping spread information about COVID through that.
Thank you. So Jab Raffles was, it simply started out as a joke with myself and my friends. And I told my friends I will reward them with a few of my personal items if they get vaccinated when it opened up for our age group. And next thing you know, the campaign went viral. It wasn't a campaign. It started out as a silly joke, and it then started to grow, and it spread across our country. And people across our country decided to enter the raffle as well. So I have a randomized draw, and people would win prizes. People would win perfume, people would win food, cash, whatever we had at our disposal. People even won boat trips that was sponsored by a law firm, several boat trips. And it's just a way to create that togetherness. And besides creating togetherness and rewarding people for getting vaccinated, it's actually a way of sharing information, and so that other people who are on the fence and who are hesitant can see, you know what, there's actually ordinary citizens doing something together as a collective, and that actually convinced people to get vaccinated.